Thank you. I'm going to set the stage for Michelle. How does it go down? So this was interesting because I was asked to talk about a topic that's not my actual research, but is really an implication of my research and I think really of the world. When I first started working on cyberbullying, the question was always, is cyberbullying similar to bullying? And as Dr. Bradshaw said, in many ways it's similar, in many ways it's not. But at the time, one thing that became very clear to me is you could not talk about cyberbullying without talking about the cyber world. And now I think it's more true for everything. You can really not talk about understanding children and youth, bullying, cyberbullying, without putting it in the context of the cyber world. It's created a whole new environment, not just for youth, for all of us, but we're talking about youth. And the thing about it is that it's always advancing, in some ways at a faster rate than we can keep up with. So youth it's really part of their life, and I think there's an exponential change for all of us, but for children, once we got handheld devices. So even younger kids, there's a wonderful YouTube about a 12-month-old baby who's playing with an iPad and loves it. It's called a magazine, It's a Broken iPad. And then she's given a magazine and she's going like this and poking. And then she actually tries her leg and then gets very frustrated and they give her back the iPad and she's shrieking again with delight. So we really have to understand that so many youth have access to it everywhere and younger ages. And the thing that's important is often we don't hear about it until something really tragic happens, like some child like Amanda Todd, somebody killing himself. And then it's front page, it's everywhere in the media, and then it's focused on the negatives, which is really problematic because then the concern, and a lot of people have made a really good case about that, the concern then becomes laws, zero tolerance, and becoming very punitive about it. And what we're missing is that, number one, it is here to stay, it is part of the new world, but also there are tremendous benefits, there are tremendous risks, tremendous benefits, and we need to understand it. And to reach and work with youth, we have to understand what platforms they use, we have to understand how they think and the benefits to help them. And many kids this generation have never experienced a world without cyber technology, which is very important. They use it for everything, and homework, you name it, they use it for. And what's important about that, and then some of the benefits for some kids, like for example LGBT youth or kids who are really isolated or stigmatized with something, they might have no other sense of community in their lives, in their real life world. So they might not be able to tell peers, they might not be able to tell school teachers, they may not be able to tell parents, but they might have an online world that's very supportive. So again, the place that's supportive might also have risks. And one of the big things too with youth, for example, is telephones. We use telephones. I still use telephones to call, and when I call my PhD students that I work with, I can tell sometimes they're irritated because they don't use it for phone. They use it for texting. So their communication and learning styles are increasingly suited to information communication technologies. So there's a need for us to start looking at these kinds of technologies for strategies and intervention. And I'm not saying that we should do that instead of the others, but it's just that we need to begin to look at that seriously. The other thing that's often said is we often say, well, kids know more about technology. They're the experts. You can always ask them. Adults don't know anything. And that may be true, but we have to remember that although they're great technologically, and although it might be very natural for them, they still don't have the critical thinking, their emotional maturity to be able to do it without adult guidance. That's number one. The other thing is it is a new world, and because it's growing so fast, nobody can just do it on their own without guidance. So, and again, we have to remember that often youth do make the right decisions, and often they use it in very great, beneficial ways, but also they do not. And they do need adults' input and guidance. So it really means that adults need to become aware of it, need to work with them on it. So I am doing a research right now on cyberbullying and traditional bullying, but mainly cyberbullying, students in grades 4, 7, and 10. And I don't really have the results of that yet. So I really want to just talk about some findings, some very preliminary things that are finding that were unanticipated that, again, just highlight the need for cyber, I think. One of the things that's come up is that when the kids, when they're asked whether they're cyberbullied, they'll often say no. And others have talked about this, but then when they start describing the incidents, it's incidents that adults might say that we might think is cyberbullying, but they call it drama, they call it trash talk. And because of the nature of the communication, there's much more interaction back and forth. So when we talk about traditional bullying, we often talk about the bully, the victim, and then the bully victim, who is quite a unique group. In cyber, we're finding that it's really not so simple, that in fact, often it is back and forth. So not that it might not be problematic, but it's not being identified as cyberbullying. The other thing, in our interviews with kids, and these are kids in grades 4, 7, and 10, when they're describing some of the kinds of things that go on, like, for example, photos being sent of girls who were pressured to send out a photo that's being distributed everywhere, they're talking about it in a way that sort of suggests that it's become, not that it's totally common or anything, but that it is more normal. They're becoming a bit more desensitized to it, that it is going on. But it's going on at a sort of a low, it's off the radar because they're not telling adults. So the only time we hear about it is when something happens, it's all over the news, we react, and then it goes silent. But when we go silent and it's not in the news, it is happening, and that's where we need to help them with it. And the other part that came out in our study is part of the research ethics protocol. Of course, we had to put in a way to identify kids who were in distress. Well, 1 in 4 kids, and this actually fits the numbers that we have found of how many kids are in distress generally, with mental health issues in school and in university. But of kids, these kids in grades 4, 7, and 10, 1 in 4 identified being really in quite serious distress where we felt we had to make a referral. And it wasn't anonymous, so they had 2 ways to show it to us. They either said they wanted to talk to somebody because they were in distress, or on the measures, it came out. And what became very clear is that we were often the first adults they had told about it. They're not talking about it. And one of the big reasons is they did not want to make a big deal. And they have many reasons about why. They don't want to tell parents and teachers because they won't understand. They'll go do something about it. It won't help, or it will make it worse. And the concern, of course, is by the time they're ready to tell, it's kind of after the fact, in the sense of they might be in very serious distress. And many of them talked about they either didn't know who they could go to in the school, or they felt it was too big of a deal to do that. And they really talk about that. They don't want to be a burden. And this is just there are many kids talking about this. They didn't want others to worry. Many of them talked about their parents having other worries. They didn't need to add a worry. So what it really highlights is that we need to find ways to, and we know the effects of this. It can be very problematic for kids, and it's interesting because working in a university, one of the big priorities for universities now is student mental health. And it's interesting to me because by the time they're getting into university, if we haven't dealt with it before, they're bringing it with them. So we really need to find ways to make it very accessible and easier for kids to be able to talk about it, ask about it. And they also have to have some control over the process. The other thing we found is for some of these kids, when we would try to recommend referring them, some would say yes, some would say absolutely no, but some would be willing to do it as long as they could have some control in it. Like, for example, they would want to come with us. They would want to be clear what could be said. And the other thing is cyber strategies and interventions may be an accessible way to disclose incidents without making it a big deal. So they can do that. In terms of existing ones, there's really no research, almost no research on any cyber interventions. The other thing about cyber interventions is that sometimes they can be dramatic, and I don't mean to pick on this one, It Gets Better project, but it can be very appealing. I don't know if people remember it. It's Dan Savage's It Gets Better. And there are others like that, and they're very appealing because it says, things were horrible for me when I was young, it got better, and celebrities, can really make a big deal of that. And the thing that's interesting and why research is very important is that we're starting to see that we just have very preliminary data on that not only did this project not always help, but it can make it worse because, number one, the message to some kids is, wait till you're an adult. Well, some kids can't do that, obviously. The other thing is we know it doesn't get better for everybody. And then, importantly, some kids actually took the message and said, well, you know what, maybe I can go take that risk. So they would tell somebody, and it wasn't safe to, because they were telling parents or teachers who were not ready to hear. So it actually put them at risk. So we have to make sure that we have online campaigns, that anything provides tangible resources to support struggling youth at the time. So again, just participants saying, these, and it's everything that people have been saying, that one-shot times do not work. So what's the potential of cyber interventions? One is that it can provide safe, sometimes anonymous, doesn't have to be. Kids Help Phone is anonymous, but I think it's good to have ones that aren't. Way to access help and resources and gain support. And we know that many youth already seek health information online. And again, it's very important that it be research evidence-based and that it be provided by people who are giving accurate information because these kids are vulnerable. And hopefully, ideally it should be interactive because kids need to be able to work back and forth with it. And some research has shown that cyber technology as a learning tool was actually helpful in increasing student knowledge, but it didn't change their attitudes about cyberbullying. But we know that anyways. We know that it's easier to change knowledge than it is to change attitudes, which is another reason why this can be one strategy, and it won't be good for everything, and it has to be in conjunction with many others. So Kids Help Phone, again, they're anonymous, but when they added their website, they found many more youth went onto the website than using the phone. The other thing is that they found that web users are more likely to disclose, and we know that's for good and for bad because there's often that disinhibition effect. And in this case, it might be helpful, but it could be not helpful depending on who's on the other line or the other end of it. But it does suggest that the nature of the cyber world might make it easier for kids to disclose things, and that therefore it might be an important avenue rather than making them hang on to it for a long time. So what do I think is recommended? That number one, it has to be continuous, it has to be part of a plan. It can't just be a single event. We know a one-shot deal does not work. And there have to be other strategies, including the community. We need to include parents and teachers. Adults need to be involved. We often say, go tell an adult, but kids always say, why am I going to go tell an adult? They know they have good intentions, but they don't know what to do. We also need to tailor it. For some kids, the intervention just can be universal education, and that will be helpful. There's others who we know are at risk. So for those kids who are at risk, they need something more targeted. And then, of course, there's ones who are much more vulnerable and are already in trouble. So we need to make sure it's tailored to that, and also developmentally. It's like any of the other interventions. And we need to continually adapt to youth cyber use. It's like we hear, youth are on Facebook, now they go off, email. We need to adapt to that. We need to be on top of them. And we need to make it accessible and easy to use to reduce some of those barriers. We really need to make it so that it's not necessarily a big deal. And one of the things, for example, it can even be, involving school personnel, school social workers or psychologists. So we don't have to take it into a whole other venue, but a way to make it available. And we need to have it evidence-based. Thank you.